What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Hello and welcome to Exposé, brought to you every Monday by the Shepherd's Flock International Church, and I'm your regular host, Akinyemi. This is streamed simultaneously on Facebook, Instagram, and YouTube. So on whatever platform, or which of the platforms that you are joining us today, we welcome you on board, and we thank you for sharing your evening with us. It's always a try-stain time when we come on Exposé, and today we have another wonderful episode for you. Your mind will be blown away today by the information that you receive, because we have another big fish in the house. You know, we started this discussion regarding medical systems, and I gave 2 episodes laying the background, trying to define and explain the different medical systems. Of course, we are all familiar with allopathic medicine, which is what is being practiced for the most part in our part of the world, in West Africa. But in other parts of the world, there are other modalities and medical systems that are also equally thriving. We've talked about homeopathy, we've talked about osteopathy, we've talked about chiropractic medicine, we've talked about naturopathy, we've talked about traditional Chinese medicine, Oriental medicine, we've talked about Ayurvedic medicine, we've even talked about African traditional medicine. All of these are different medical systems that thrive in different climes, different cultures, and in some instances, the best of these are fused together into an integrative approach to getting the best outcome for patients and clients. And so we have so far brought different practitioners in some of these medical systems. We have interviewed a naturopathic doctor, a homeopathic doctor. We have interviewed an osteopathic doctor. We have interviewed herbal medicine practitioners, and today we have an allopathic doctor, someone who originally trained in conventional medicine, what we know as orthodox medicine. He trained at the University College Hospital of the University of Ibadan in Nigeria, the premier university in Nigeria, and one of the foremost teaching hospitals in the whole of the Commonwealth, not just in Nigeria. And today he also has a lot of interest in other modalities. And so he has had the opportunity and privilege of training wide in other modalities. And so he's many things rolled into one. And we are very honored and we are very happy to have him in the house. Like I normally do, I allow them to introduce themselves, give us their background. I mean, all of these for credibility's sake. So at least we know that the person we are talking to is not a novice. The person we are talking to is an authority, is an expert in that particular field where we interview them. We've even had the privilege of having someone who has worked with the FDA right on this same platform. And today we have another person who has practiced for years. Right now, he is practicing at the teaching hospital at the UCH in Ibadan. I'll allow him to give us the details about his background. And after that, we're going to be moving into a conversation around integrative oncology in particular and integrative medicine in general. And so today we want to welcome to the house Professor Kayode Adedapo. You're welcome, sir.
Thank you very much, Reverend Tony. It's a privilege and an honor for me to be here. Talking about my background, I must say that coming to medicine was something I had desired as a young chap. And I came into the University of Ibadan in 1982 after JAMB examination. And I finished in 1989 with the MBBS degree of Ibadan. Excuse me. Thereafter, I did the mandatory housemanship and I proceeded for youth service. After youth service, I came back and I specialized in chemical pathology aspect of pathology. Pathology has 4 branches. We have the anatomic pathology, we have the hematology, we have medical microbiology and parasitology, and we have chemical pathology. Now, in Ibadan, immunology is part of chemical pathology. So I had the privilege, in fact, my stint was first with immunology before I zoom in for chemical pathology. And I finished my training in 1999. So I became a fellow of the West African College of Physicians in 1999. Thereafter, I started practicing in year 2000. I became employed as a consultant physician, laboratory physician with the University College Hospital. And it was there, when I started there, that I got introduced to Reverend Tony through my my pastor friend, Pastor Bode Akindele. And since we got to know each other about 20 years ago, it's been a different story entirely. In fact, the story I'll be telling today will not be complete without his input. Now, what actually brought me into treatment of cancer patients was my introduction to nuclear medicine in the year 2005. Because in chemical pathology, we deal with the chemistry of the blood, how to lower cholesterol, right, how to, ensure that the right result is given to the public and it is interpreted appropriately so that the physician can take action. But in 2005, I did a project for my master's, and I was looking at carcinoembryonic antigen as a way of, following up patients with breast cancer. So I needed to use radioactive tracers, and that was what brought me into nuclear medicine terrain. I was privileged in 2005 to go to India to learn more about nuclear medicine. When I came back, we started nuclear medicine practice in Ibadan in year 2006. In 2008, because of the love I have for nuclear medicine, I was privileged to go to the University of the Witwatersrand, where I obtained a clinical master's in nuclear medicine. Now, with that...
That's in South Africa.
That's in South Africa. With that exposure, I now had the privilege of using radioactive tracers to treat patients with thyroid cancer. So that was what brought me directly in contact with cancer patients. But what I learned was still not sufficient, because all I had to do was to take history from them, grade their disease, and give them radioactive iodine to wipe it off. It was fortuitous that I had known Reverend Tony then. And in the year 2016, after practicing nuclear medicine for about 8 years, I had the privilege to go to Germany to meet 2 gentlemen, Dr. Henning Saupe and Dr. Christensen. These were the people that introduced me to integrative oncology. And since I came back, I've been into the practice of integrative oncology, particularly with Reverend Tony Akinyemi, and with some of the patients that, are willing to explore the alternative opportunities that is available for their cure. So what I will be sharing largely will be based on what I garnered when I was in Germany with those 2 gentlemen that I mentioned. And I must particularly state here that the Shepherd Flocks Ministry and Raphael Institute of Elder Living played a big role in facilitating that trip. I cannot forget that, sir. Thank you very much for the opportunity. So I'll be sharing largely from my experience way back 2016.
Thank you so much. You have said so many things and very intimidating credentials. You made mention of some very big grammatic words there that, most of us listening are laymen. And we were hearing carcinoembryonic antigen, which is CEA, I believe.
Yeah, yes.
That's right, yeah. And then you mentioned nuclear medicine. And people will be wondering, which one is this again? Of course, it was when I met you that I got to hear about nuclear medicine for the first time. So I want us to take it in such a way that people will, those of us who are laymen, will be able to understand clearly, precisely what you're saying. So nuclear medicine, that's not what we're talking about today, but I just want you to say in 30 seconds, what is nuclear medicine? You mentioned, radioactive iodine and blah, blah, blah.
Yes.
But let's just situate it so that people can know what that is all about. That is not our focus today, but just to help people grasp exactly what that is. Nuclear medicine.
Thank you very much for this opportunity. Mm-hmm. Nuclear medicine is a branch of medicine that uses radioisotopes to either make a diagnosis of diseases in the body or to treat them.
Right.
And what it does is that radioactive tracers are injected. Sometimes they are swallowed or sometimes they are inhaled. And when they get to the body cavity, it is possible to now use a camera to trace those isotopes in the body, either to see the physiological function of the organ of interest,
right,
or if it's a disease like thyroid cancer that we want to treat, we use the tracer to demarcate where the cancer is located primarily, and then we give a bigger dose to now treat. And because some of these organs, we use chemicals that are attracted to the particular organ of interest.
Okay.
For instance, if we are talking about the thyroid gland, we use a radioactive iodine. And normally, physiologically, the iodine, the thyroid gland will pick up
the
iodine.
Yeah.
So when we label it with radioisotopes, it means that we can image it, we can look at the shape, we can look at wherever it has spread at the different parts of the body, and that will enable us to now quantitate how much of radioactive iodine that we're going to give to exterminate that disease, primarily in the neck and wherever it has gone to in the body.
Okay.
Now, it can be used for various other disease entity or cancers in the body. But my own specialty is in the area of
the thyroid gland. That's right. Thank you very much, sir. Because we are not discussing nuclear medicine today, I will not ask you questions regarding possibilities of adverse effects in the body, since these are radioactive elements. But we will leave that for another time. Our focus today, I don't want us...
I must close that very in a safe manner.
Okay.
Now, we give the dose in such a safe dose
right.
that it will not affect the other healthy part of the body. It's unlike chemotherapy.
Okay.
It is specific. It goes to the organ of interest, and because we will have known the weight of the gland, we can give the exact dose that will just do the internal damage to the cancerous cells and leave the healthy cells intact.
All right. Thank you very much, sir.
Maybe some other days we can talk
about that. Yeah, more. That brings me to one of the philosophies of allopathy, which is identifying the diseased part of the body, the sick part of the body, or the affected part of the body, the organ of interest, the gland of interest, whatever, and then devise remedies that will go after that area and deal with it. For example, if somebody has malaria, you have anti-malarial drugs that is looking for particular parasites to target it. Somebody has an infection, whether it's viral or bacterial or fungal, you are looking for antibiotic, you are looking for antivirals, you are looking for antifungals and whatever. So one of the philosophies of allopathy is to attack, to go against. So most medicines used in allopathy is anti this, anti that, anti-hypertensive, anti-diabetic, anti-diuretic, anti-blah, blah, 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 blah. So one of those philosophies of allopathy, which is different from homeopathy, which has an opposite paradigm. So it's interesting that the organ of interest is what is targeted with nuclear medicine to be able to address that. Now, I know that with your vast exposure in integrative medicine, we now know that targeting either thyroid cancer or any other cancer for that matter goes beyond just hammering on that particular area that is cancerous, but it takes a total body approach to getting rid of cancer and preventing recurrence. And that's why I'm so happy that we'll be delving into that dimension of discussion in integrative medicine. But before we go there, I want you to also tell us what got you interested in alternative medicine, integrative medicine as a conventional doctor.
Well, I have seen many patients suffer. Like the Bible says, my people, are destroyed for lack of knowledge. Unfortunately, those of us that are physicians who are meant to treat them have been programmed to think of remedy in the way you spoke about.
Right.
Give something that will either suppress it or make the person feel better. So, in coming in contact with patients over the years, and having come in contact with you particularly, and I must always say this, I began to think outside the box. And I began to see that indeed there must be something else that can be done to help people who are suffering from one disease or the other. So I began to experiment, even on myself, because at the point I was beginning to develop arthritis, I was beginning to have some things that looks like enlarged prostate symptoms. And I said, well, I've heard about all these things. Why don't I try it? And when I began to use it, I began to see changes that cannot be attributed to the conventional medicine. And a few people that are close to me have also recommended this, remedies to them, and they seem to get better without side effects. So my interest became more keen. And so when I began to see patients with thyroid diseases, I don't only talk about treatment, I begin to take them to nutritional level.
Right.
That there are some things you need to avoid if you don't want this thing to come back.
Right.
Because there is recurrence in cancer. And if you continue or go back to your lifestyle, it's most probable that the disease will come back.
Right.
So that was what gave me the desire to know more. And you will notice that I will come to you, I will ask questions. You gave me a lot of books that opened my mind. And these are the few things that I would say actually open my eyes into this wider dimension of treatment than just orthodox.
Right. Thank you very much. And by the way, it was when you were talking about signs of aging that you began to experience, like arthritis, like enlarged prostates and blah, blah, blah.
Yes.
That brought to my mind that the way you are looking, you look like 40-something. And nobody will know that you're in your 60s already.
Yes, by the grace of God.
To God be the glory.
Yes.
All right. So you are a testimonial to your own practice. We thank God for that. Right. Okay. So I want us to now begin to look at integrative medicine as a whole. First of all, give your perspective to us on what is integrative medicine before we go to integrative oncology. What exactly, just in the summary, what is it all about?
Well, thank you very much, sir. I delve into the aspect of nutritional rehabilitation. Over the years, we have believed that we should base our food on the three primary major
macronutrients,
macromolecules,
right,
or what we call calories.
Right.
Calories largely from carbohydrates. We get our proteins, from animal products largely. Nobody ever told us that plants has as much, protein as even some of the animal products we take.
Right.
And of course, fat and oil. And so traditionally we are brought up to cook our food. We cook almost everything. And if we even boil our vegetable and pour the water away, But like I said, understanding of the fact that the major thing that prevents diseases is what we're taking. All right. So I began to integrate that into my practice. So integrative medicine is the ability to bring in what will bring wholeness to us as individual than just to identify disease, make a diagnosis and treat. So integrative health is to understand that diseases don't just arise, they are caused by our lifestyle, by what we indulge in. And when all these things mature, they manifest in diseases. So an integrative approach is not just to be sick and go to the doctor, but to actually live in an environment that is healthy, eat the food that is healthy, that is able to maintain health. Because the good Lord, when he made man, situated man in the Garden of Eden. And there in the Garden of Eden, they were meant to eat herbs and the fruits and vegetables, in the garden. There was not a mention of killing an animal to eat when they were in the garden. So I believe it was after they left the garden, even though then they were still living a very long time. But over the years, we major in preparing our food cooked, and so on and so forth. So I believe that integrative medicine is the ability to bring in or take man back to nature with the fruits and vegetables, to eat well, to live in a good environment, to drink good water, and to prevent rather than to cure or restore health.
Thank you very much, sir. And if I may ask this, in your practice as a clinician, how have your patients received this dimension, this approach? What has been their attitude to when you introduce these other dimensions to them, apart from just prescribing medications?
In fact, that brought me to my early days as a young consultant. Way back up till 5 years ago, I'm always at the clinic, because why I came into medicine is that, it was initially that I love to interact with my patients. So I can spend 15, 20 minutes, even when I have 10 others to see on each of them. So what do? I take them, how was home? What happened? I would take family history. I would take social history. How are your children? So before I even go to what has brought you to the hospital today, they are already at ease. They are happy with me. And when I then introduce that, because I see a lot of diabetic patients, hypertensive patients. So by the time I now give counsel that, what made your result to be not too good today is because of this that you have done. And then I will encourage them, if you can stop this and you begin to do these other things, change your diet, don't use Maggi, use sea salt, prepare, the first thing you should take is fruit and vegetable salads. And they come back in 4 weeks and they are happy, they are jubilant. Where am I going? When I stop going to the clinic because I have some other responsibility now in nuclear medicine, they will come and they will be asking, where is Dr. Adedapo? And those who have my number will call me, I'm in the clinic, but I can't see you. I wish to see you. I was even telling my daughter just a few minutes ago that a lot of these people are not comfortable that I'm not in the clinic again. But of course, I've trained younger ones to now take over. All these things I'm passing over to my junior ones who have become consultants also, so that they can pass it down the line. It is the fact that integrative health or medicine works better than just, orthodox medicine. That's been my experience, and my patients, they love me for this. And many of them even come to buy supplements from me. When I say, okay, I have something that can take care of that, would you rather like to have this supplement? They're glad to buy it. And they know it's not exploitation. They will even say, doctor, I'm sorry, I'm saying that in English. Some will say, that's in Yoruba. Your colleagues may not like to hear this or that. I said, no, I'm qualified to give you what I'm giving you because it works. And I also use them.
Thank you very much, Prof. We will take a short break right now, and then when we are back, we will continue this very important discussion on integrative medicine and dovetail into integrative oncology. We will look at how this is practiced in other climes, and then we'll also explore how we can make this also happen in Nigeria. Of course, there have been some attempts to make this happen in Nigeria. It's still in its infancy. We hope to see it grow and develop and become mainstream as time goes on. It becomes the mainstream philosophy of caring for patients, of combining different modalities that will improve outcomes, clinical outcomes at the end of the day. So don't go away. We'll be back shortly. And don't forget, what we need is not more medication, but more education. For the best prescription is knowledge. We'll be back shortly.
My name is Mrs. Damilola Ogulabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this elder living.
Welcome back. This has been Exposé, brought to you by the Shepherd's Flock International Church. And I am always your regular host, Tony Akinyemi. And this is brought to you every Monday at 8 p.m. Nigerian time, simultaneously on Instagram, Facebook, and YouTube. If you're on any of those platforms, do your utmost never to miss another episode. And in fact, if you have missed previous episodes, they are always available on YouTube in our archives. Just go to YouTube and type in the search engine Exposé with Tony Akinyemi, and it will bring all previous episodes. Quite a number of people send emails and WhatsApp messages to me saying, "Oh, I missed a particular episode. Can you please send it to me?" And I tell them it's all of them. They are always there on YouTube. You can always go back there. And the way not to miss another episode is for you to subscribe to our YouTube channel and click on the notification bell, or to simply like us on Facebook or follow us on Instagram, and on a weekly basis your device will notify you whenever we come streaming. And so today we have in the house an associate professor of chemical pathology at the University College Hospital, University of Ibadan in Nigeria, West Africa. Incidentally, he also helps to consult with us and facilitate for us, rather, at the Rafa Institute of Healthy Living. We are honored to have him all the time to come and deliver lectures, and it has always been very illuminating, loaded with experience and with versatility. We have in the house Professor Kayode Adedapo. You are most welcome. We've been talking about his background. He has a background in conventional medicine, orthodox medicine. He is a consultant chemical pathologist. He also has a master's degree in nuclear medicine, as well as some training in nutrition and integrative oncology in Europe. And today we want to start this discussion more on the integrative oncology aspect of his background rather than the other aspects of his background. He has already explained to us what nuclear medicine is in a nutshell, so that those of us who may be hearing that for the first time, at least you get to know that people who have thyroid cancer can use guided radioactive iodine to be able to target the cancerous cells and wipe them out. And of course, beyond that, there are other aspects of lifestyle and diet that also require adjustments, and we are thankful that such a person like him is very informed in that area. So patients don't just get iodine shots, they also get counseling regarding their diet, regarding their lifestyle, how not to recreate the disease, because diseases recur when we do the same thing that we did that brought them on in the first place. It's like we are recreating the problem, because 2 + 2 will always be equal to 4. If you go back to the same things you did that created the problem, it's likely you are going to recreate the problem. So when the problem has been solved, you need to start doing things that will not allow the problem to come back again. I see quite a number of women who have fibroid. They go for surgery and the fibroid is taken out, and 2 years down the road and the fibroid is back. And they keep wondering. In fact, one woman came to me the other day and said, I have done surgery for fibroid 4 times.
Wow.
4 times. And he said, now they say I have fibroid again. He said, what am I going to do? I said, I told them never again. So he said, somebody told me to come and talk to you, that you can help me not to do surgery. I laughed. I said, well, I don't know how to help anybody. It's God that helps everybody. I can give you a piece of my insight, and you can deploy it. It's your human right. It's your constitutional right. And when you deploy the knowledge that I share with you, and hopefully God can step in and you can get some results. And we've seen very fantastic results where people have been able to either melt away fibroid altogether, or they did the surgery and then they changed their diet and their lifestyle so that 5 years, 10 years down the road, the fibroid never comes back again, because the recipe that creates fibroid has been changed. And so the outcome also will change. Now, let's go back to integrative oncology. You mentioned in your introduction that you actually did an internship in Germany.
Yes.
In integrative oncology. Can you talk about where you did that internship, and maybe we then progress to look at how do you compare the approach there to the conventional approach here, to make some distinctions between how integrative oncology works and how conventional oncology works, and what are the, and they would normally say in high school, compare and contrast.
Yes, I'll try to do that.
All right,
I'll try to do that. Thank you very much. I was privileged, like I said, in 2016 to go to Germany, and I was at this institute that is called Acadia Praxis Institute, or Acadia Praxis Center. And there are 2 gentlemen there that I met who are trained physicians and who have also delved into integrative oncology. Now, the first thing that struck me there was the humane approach,
right,
to training or treating their patients. What happens is that one of them will have had a Skype meeting with whoever has the disease.
Okay.
So they're able to profile and invite you now to their center.
Okay.
Let me first start to say that there is a philosophy that they hold, that cancer particularly is a complex metabolic disease that has several complexities rolling up to produce uncontrolled growth of cells, which we call cancer.
Right.
They believe also that the approach to removing cancer cells should not be conventional like what we do in orthodox practice.
Let me
just give to kill the cancer cells.
If I
For instance, they believe that there are several pathogenic mechanisms that cultivates in production of cancer. I'll list about 3 or 4. The belief that there is low-grade inflammation,
okay,
snowballing into chronic inflammation, to tissue overacidity, reduced pH, mitochondria dysfunction. The mitochondria is the energy house of the cell. And when you have chronic inflammation, you have increased acidity of the cell. The body normally will better function in a slightly alkaline pH. And when you have the environment in which the pH is very low, that is acidic, and then there is reduced oxygen tension within that same environment, it's a very rife environment for cancer to develop. So, under that condition, the immune system will be hampered. It will find it difficult to, these immune cells will find it difficult to move, and the natural killer cells in our immune system will be unable to target the cancer cells and remove them. So when you look at the constellation of every of this deranged environment, and what you then do in conventional treatment is just to give chemo to attack those cells that have developed under the unhealthy environment. They believe that that is wrong. So what do? They will first look at your peripheral blood film, and they use a system that we call dark field microscopy.
For live blood analysis.
Yes. It's a very simple procedure in which your blood is, you have a jab on your finger, and we do a blood film, and it is placed under a dark field microscope, and it is projected on the screen. Now, you will observe that when there is low oxygen tension, there is hyperacidity, there is immune dysfunction. When you look at the cells under that environment, they are clumped together.
Right.
And there is a lot of fibrin degradation product showing chronic inflammation in that cell. When you yourself that is sick sees that picture, you will know that already you are sick. And so they will now point it out to you that, do you know that all these have come about because of different derangements? So you are brought into the picture, and thereafter they begin to explain to you the various modalities of treatment that they will use to keep your environment healthy once again, so that your immune system can be brought back into play, and then they can remove the cancer. That is one of the first steps that they take. They will first take a history, make a diagnosis, and get you involved in your treatment. In the conventional system, the doctor will just tell you have prostate cancer stage 4, and these are what we're going to do, and that's it. You don't even have opportunity to ask whether there are alternative means of curing yourself. They will just tell you, no, the only thing that is available is for us to give you chemo, or sometimes radiotherapy, or a combination of both. What about the immune system that God originally placed there? What if they are enabled? I do agree with them in a way, because once cancer has become clinical, it becomes too big for the immune system to be able to take it apart. However, even if we are going to involve surgery, if this person can now be told what to do to get back the immune system in operation, of course, there is the likelihood there will not be a recurrence, and whatever is remaining in the body can be removed. So at the center where I trained, I interned, all these are taken into consideration. You are brought into the play of treatment, and you participate in your own therapy.
Thank you very much, sir. So many things have come up that I would like us to highlight a little bit. You talked about inflammation. It could be chronic, and it could set the stage for many things. You talked about acidosis.
Yes.
Then you talked about mitochondrial dysfunction. Now, these are all different parameters within the body environment. And you said that kind of makes the body very conducive for cancer development and for cancer to thrive. Now, which brings us to the question of terrain as well as the the disease entity itself, the environment of the disease, and then the disease entity itself. I remember one of the physicians at that center, Arcadia Praxis in Germany. One of the physicians was supposed to visit Nigeria in a particular year to deliver a lecture at UCH in Ibadan. But somehow that didn't work out. I also remember I was supposed to give a short presentation before his own main presentation. I still remember the topic that I wanted to speak on at that time, which was programming the terrain. That was what I wanted to talk about, programming the terrain. I know you are very familiar with these French scientists, Louis Pasteur, and Antoine Béchamp, who were contemporaries in their days. And Louis Pasteur came up with the germ theory of disease, where most diseases were traced to germs. And so the idea of pasteurization came, where you have to pasteurize to kill the germs. As long as the germ is dead and it doesn't get into the body is safe. Whereas Antoine Béchamp had a different approach. He felt that the germ was not the problem, that the terrain of the body was the problem. That if the body was very fertile and very conducive,
in optimal health,
he believes that if the germ gets into the body and the body is hostile to the germ may not thrive. But that if the body is very conducive for the germ gets there and wreaks a havoc. So he believes that you don't worry your head too much about the germ. Not that germs don't play a role at all, but if the body is very robust, optimal health, immune system is at its peak, and there is all the parameters like inflammation, like the pH of the body, like the function of the mitochondria, and the oxygenation of the body, and all of those things are in top shape, then the body is so strong to be able to contend with any assault or insult that may come against it along the way. But that if the body has already become deranged, like the word you used, the internal environment of the body is already deranged, then anything can happen. So the approach you have shared with us now is that at that clinic, the focus is not to identify this is the tumor, or we have a tumor in the prostate, we have a tumor in the breast, we have a tumor in the colon, and then we go after it. We either cut it out, or we burn it with radiation, or we poison it with chemotherapy. That's why some in the natural community mischievously call allopathic medicine the cut, burn, and poison syndrome. Now, but you are saying that apart from targeting the cancer tumor, you also need to reprogram the terrain.
The environment.
The environment. You need to transform the environment, change the pH of the environment, tackle inflammation, deal with oxygenation, bolster and modulate the immune system, and all of those things. So everything comes together so that even when the whatever other remedy we are using to attack the cancer, the body also joins forces along with whatever remedy you are bringing. So it's a team effort now. The body is cooperating with whatever remedy you are putting into the body to tackle the enemy together. And the chance of winning becomes much higher in that instance. Yeah.
That's right.
Thank you for laying that out very well. Now, live blood analysis, I did it once. You mentioned live blood analysis. I think I did it. I did it in the US. I think that was in the year 2005, if I'm not mistaken. 2005. That should be some 16 years ago. I was with Dr. Ernest Cohn in Wilkesboro at the Holistic Medical Clinic of the Carolinas. He has retired now, but his daughter is running that clinic right now. We hope we can get Dr. Cohn on Exposé one of these days to also share his perspective.
That would be good.
Yeah. So when I was there, they did live blood analysis for me, and something was amazing. You know, I was looking at my own blood on the screen, and he was showing me something that they said that's a fungus. That's a fungus right there in my blood. I mean, I had.
It's 14 hours.
And I was dazed. I said, wait a minute, what's he looking for there? How did he get there? And I saw my red blood cells were clumped together like that. And he said, look, we have to declutter, as it were. We have to get these things to separate to increase the oxygen carrying capacity.
Yes.
When the blood goes through the lungs, it will be able to attract more oxygen when it is not clustered together. But when everything clustered together, it impairs oxygenation. And they began to work on
the
me.
movement of the immune cells. Yeah.
That's right. In fact, he showed me some of the white blood cells that were almost frozen. They were just, he said they are supposed to be moving.
Sluggish.
He said they were supposed to be moving, yeah. But everything was sluggish. And they had to start doing all kinds of detoxification, all kinds of massage therapy, all kind of lymphatic drainage and what have you. And it was part of the things that I did that helped me to bounce back when I was dealing with my health issues in those days. So I want you to talk a little bit about live blood analysis before we go into other protocols.
All right. Now, it's a very painless procedure. It's done in the consulting room because the microscope is there in the office. Your fingertip is cleaned, and just like for those who normally will receive insulin shots, just a tiny prick, a drop of blood is taken, and it is placed on the slide. In fact, that's one of the first things you do when you get to the clinic, because we want to register in what situation you came for treatment.
Okay.
And so that is shown on the screen, on a large screen. You will be looking at the microscope. You can see what is going on the large screen. And so you see your own blood, just like you saw yours. And then you will be so shocked that, so this is what is going on in my body. And then you'll be told there is a remedy. I forgot to say that, under the picture we have painted, there is also adrenal stress.
Okay.
With copious release of cortisol.
Right.
Which will worsen the glucose control of the body. Cortisol increases blood glucose. It mobilizes, glucose from even non-carbohydrate sources.
Okay.
Under that condition, more glucose is just roaming about in the system, which is an environment in which cancer thrives.
I see.
And the cancer itself, they are very intelligent. They just want to make everything conducive for their, continuous growth.
Right.
And so once you see that, and you are told that we need to tackle whatever has brought you to this clinic using a multi-pronged approach, which is the issue we're talking about today, the integrative approach.
Right.
So the first thing that they would then talk about is detoxification.
Okay.
Detoxification. So I don't know whether you want me to go into that now.
We will.
The toxic environment will make the enzymes not to work. Things will just be down.
Right.
So the person will feel sick, depressed mentally, depressed bodily. There is no strength to move on because even the food the person eats is not used to produce energy.
Right. It is so complex that we'll have to take them layer by layer by layer. And unfortunately, I am receiving signals that our time is up for today.
Wow.
We have not even started.
So fast.
We have not even started. And our time is up. But this first episode is usually dedicated to getting to meet the person and then get an introduction into the discussion. I believe in the next episode, we will be able to go straight into the different treatment models. Probably also look at diagnostic approaches in integrative medicine as opposed to conventional medicine. So that all of these things can be put together. And then there is a particular one we also want you to talk about, which is IPT. When we do episode 2 on this particular one with you, we look forward to having you next week on the same platform again. Before you go, sir, can you please just because I know that my people want to connect with you immediately, say, this prof that you brought, how can we talk to him, how can we meet him and all of that. I know you are in UCH Ibadan, so those who are in Ibadan, they have somebody at their backyard. Maybe they were not aware you are there, now they know. But there are other people from around the world that may want to connect with you. So however you want them to connect with you, please let us know, whether by email or by WhatsApp or by telephone, or if you have a personal website or something like that.
Yeah, I will normally use my Yahoo email, and it's K for Kayode, KS, S for Solomon, KS Adedapo at yahoo.com.
They will put that on the screen.
KS Adedapo at yahoo.com. And SMS only 0806 209 8091.
One more time,
That's
sir.
available for.
One more time, the
That's
telephone
available
number. The telephone number.
0806 209 8091. They can reach me by any of those two methods.
Is that number on WhatsApp as well?
It's on WhatsApp, yes.
Okay, because some people prefer WhatsApp to SMS.
That's okay.
All right, so we have your email address, we have your telephone contact for WhatsApp and SMS only. Please don't disturb Professor.
SMS and WhatsApp, of course.
Don't disturb Professor Adedapo on voice calls, please. He's so busy that we don't want to become a nuisance. We want to be able to work with him at his own convenience. So please, you can reach him by WhatsApp, you can reach him by telephone, SMS, and you can send him an email on ksadedapo@yahoo.com. Thank you once again for being on Exposé today. We hope to see you next week again to discuss the details. And viewers, please don't forget that this is Exposé, where we expose, unveil, reveal, uncover, this time not crimes and negative news, but positive information for your transformation. We believe that what we need is not more medication, but more education. And the best prescription is knowledge. Thank you again for spending your evening with us. We'll see you same time on the same platform next week, Monday. And you can watch all the previous episodes at any time at your own convenience. Go to YouTube and type in Exposé with Tony Akinyemi. And don't forget to always share this link also with your family and friends. They will thank you for it. Then also comment in the chat room each time we are on. Your feedback is important to us. It helps us to know the areas to focus on and what to address and so on and so forth. Thank you once again. I'm your regular host, Tony Akinyemi. Bye-bye and God bless you.
My name is Mrs. Damilola Make's. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this elder living.